Heidi, it's my pleasure and privilege to have you here today.
Nice to see you again.
Okay, so the thing is that what we are trying to do every time is to talk about something that's really important for everybody's health, and this we deal with it every day. Do you have anything in mind? We can shed some light.
I would say a very typical problem that people complain very often. And earlier I thought it's only about seniors, but later on I heard about this issue from a lot of people of like my age and even younger. I'm talking about arthritis, and people suffer from all kinds of arthritis, not just hands or legs or all over the body. And it looks like it's an illness of the century, I would say.
Well, I'm glad that you raised this question. It's a very good question because we deal with arthritis every day, and basically I'm trying to put it in order, and I think in order to explain what's going on is to put arthritis in three big categories. First is arthritis because of the extensive use. Okay, so
what do you mean?
No, if you use a pen, too much, what will happen to the pen? It eventually will break down very soon, right?
Okay.
So if you use that too often.
Computer, you mean?
No,
desktop, and then something problem with your fingers?
Whatever.
That's what you're saying?
No, the pen.
Yeah, I understand.
But you're right. So basically the same thing. If you use it too much, so it will break down. That's what it is. So basically what it means for arthritis is that if you use a joint in a way you're not supposed to use, you can break it down, right? Well, let me give you a very simple example.
Yeah.
Knee joint, right? Okay. And 320-pound man.
Oh no.
Yeah, so basically I'm just exaggerating a little bit. I mean, I have this patient, this kind of patient, 320 pounds, but I'm just giving you a sense of it.
You have such patients?
Of course. Yeah, but I'm just giving you a sense of it. So if you put a 320 pounds on both knees, and they're supposed to sustain like half of it, so what will happen to the knee? It will break. Okay.
So are you implying that excessive weight is a factor? That's what you're saying.
Factor. Not necessarily. Who is participating in professional sports?
Yeah, they could be like.
Yeah, they're doing it every day, so it's not supposed to be done. And
yeah, that's true. So it's not just like seniors. It's not just overweight people.
No.
It's a very typical disease.
Of course it is, because I have a lot of professional sportsmen or sportswomen who come to my office and complain of pain all over the body, and that's understandable. And let me just clarify one thing. It's not only excessive weight or something, excessive use, but traumas. Who is participating in sports, they fall down, right?
Correct.
Especially gymnasts, gymnasts, they tend to fall.
Yeah, runners.
Okay, yeah, and also, the important thing here is this, vitamin D deficiencies. Because supposedly there is a sportsman or a sportswoman, especially sportswoman. She is doing gymnastics, and at the same time nobody checks her vitamin D. So what happens if she falls down? It's not only extensive use, but it's a broken leg or whatever it is. Okay? So as soon as something is broken, you change the way joint works. So that's the way it is.
But supposedly every sports team is supposed to have professional doctors who give advice, and you're saying they don't say anything about vitamin D, they're not saying about any precautions?
I'm not aware of that. Maybe they do, maybe they don't, but that's what we see. All right? So,
and also, is it true that the best treatment from all kinds of arthritis is injections in all kinds of body? Is that to prevent pain, or pain management? How do you go?
I don't think so. I mean,
no?
Depends on the situation. Supposedly, somebody has a very bad arthritis.
Okay.
Very bad arthritis. There's nothing can be done, and patient is suffering from excruciating pain. So the only option we have is to do injections. But I'm against that unless it's really necessary. There is no other option.
Do we have any other options?
It depends on the stage.
Options?
if a joint is worn out altogether, so what else can be done? It's not that much we can do.
But if it's just, I would say, preliminary stage, it's not like emergency, it's not like broken or anything like this, but just like person feels something like, and you checked and you made pictures and X-ray, whatever.
No, X-ray usually don't give that much information, but we are trying to figure out why it happened.
Why?
Why it happened. So is there excessive wear and tear? And that's we advise either to stop sports activity or to reduce weight or some other measures, depends on the situation. And that's pretty much it. So we are hoping that the situation will improve.
So if person stops...
Yeah, weight reduction, who comes with hip pain, hip joint pain, knee joint pain, and weighs 250 pounds, so that's just in front of you, just obvious.
But I know arthritis is not just knee, but like it could be all over the body. I know about arthritis in hands. I know like people complain to me that they have problem even again in not just knees, but
no, I know, but who is doing supposedly laundry? What do? They use their hands, right?
Okay.
Too much. If they're professional doing this, so what do you expect? That's what we are trying to prevent.
And even again, I heard about people who are on typists,
yeah, the same thing.
I see people all over, like in subway and somewhere, wearing stuff specifically because it looks like they wanted to help when they work on keyboards.
Yeah, that's the same thing. So just wear and tear. That's what it is all about. The second thing is that autoimmune arthritis, and basically what we are talking about here, like rheumatoid arthritis, SLE arthritis,
So
whatever it is.
how to prevent it or to fix it?
That's the hard part. So basically, we need to fix the immune system, and basically the reason why somebody has an arthritis, the reason is that our own antibodies start attacking our own tissue, like joint tissue. And the reason for that is usually the problem in the digestive tract because of the mimicry. Let me explain you. There is a so-called mimicry theory. What happens is that, as you know, in our gut there is a lot of good bacteria, right? Good bacteria, bad bacteria, whatever it is. Just good bacteria mostly. Okay. Supposedly everything goes well. We have good bacteria, but somehow good bacteria are not attacked by our immune system. And you know why? Because they camouflage. Supposedly, have you ever gone for hunting or something like that? No?
No, I'm not a
Okay,
hunter.
no, not a hunter. Okay, but did you do any did you have any training, military training?
Yes, of course. Yes.
Of course, if you had military training, so if you go, no, not that, but supposedly you're going and there is an enemy is in front of you. How are you going? You're going to present yourself, put something red, just stand up with the gun, or you put some kind of you dress like like in something green, like to make sure
of course.
That's called camouflage.
Of course, I know what camouflage.
Yeah, so that's what you do. You put some camouflage to protect yourself from being discovered by the enemy.
To become a target myself,
Yeah.
of course.
So the same thing what they do. They try to look like our own tissue. And that's why they are not attacked by our antibodies, but our immune system. But what happens if the barrier between the gut and the blood is broken? So what happens is that those good bacteria that camouflage, they look alike our system still goes into the blood. And what happens is that they go too much attention to our immune system. Okay, because suppose the same thing as you're in military, even though you wear camouflage, you start shooting, you will be discovered, even though you use camouflage, right? So until you don't shoot, your camouflage is okay. But as soon as you start shooting, camouflage is not okay anymore. The same thing happens here. So what happens is that immune system recognize those good bacteria as something bad, but it looks alike our own tissue. Okay, and what happens is our immune system starts producing antibodies that hits that bad bacteria or good bacteria, but at the same time they hit the tissue that looks alike.
On a more pragmatic level, I've heard also stories that, like, besides any kind of antibiotics or pills or injections, there are more simpler way, I would say, to treat arthritis in your body, specifically spending more time on the beach under the sun, swimming in pool or an ocean. Is it true, or it's just...
Not to my knowledge, not to my knowledge. The only thing that can help, in my understanding, is just get sunlight. Because of the vitamin D.
So that's why I'm saying,
vitamin D. But not that much. The most important thing is to make sure that your gut is working properly. Because if there's connection between gut and blood, is still normally there are tight junctions between the cells, so the gut content doesn't go into the blood. But if that tight junctions are not working properly anymore, so that's what creates the problem.
Because usually with you, it's like so many cases. You're saying when digestion seems to works perfectly well, it helps everything else. You always emphasize this.
No, but that's what it is. You know, that's why my accountant says garbage in, garbage out. You know, that's the same thing. Garbage gets in, you know, you'll get garbage out. But the same thing. I had a patient who was...
But I never knew it has any relationship to arthritis, you know.
Of course. And I had a patient, basically, I cannot take credit for curing him, but he did it himself. He had a rheumatoid arthritis. And he decided not to take the conventional pills, and he just eliminated gluten, and his arthritis was gone. So when he came to me, he said, you know, Doc, I didn't need those pills, you know.
So what, he changed his diet? What do you mean?
Gluten-free.
Everything is gluten-free?
He went gluten-free. He
Wow.
did yeah, but he did it himself.
You see, gluten-free can help even to solve arthritis.
That's what he said. I didn't see him, but that's what he said. All right, and I believe him.
So what we eat also affects arthritis. It's not just injections or pills.
You know, it does affect, provided you do it correctly. As we said, that if we are talking about gluten-free diet, you need to be strictly gluten-free, you know that. All right.
Also, you mentioned that it's not enough to have X-ray. How else you can find
Usually we prefer MRI because X-rays is not that sensitive. And infection, the X-rays usually miss fractures, etc., etc. So I prefer MRI, but that's my own preference.
And also, I know that arthritis is like usually treatment is much longer than any other disease.
Of course,
it can take years sometimes.
Of course, because autoimmune disease is long story, and you need to really put a lot of effort in it, and that's how you can get some progress. And also, I would like to mention this third category, extremely important, is infectious arthritis.
What do you mean?
Lyme.
So a person can get it like from some...
In my understanding, whoever comes to this office and complains of joint pains, they have a Lyme test. Okay. Yeah, because I was in some training, and the guy who was teaching me how to drive a car, he said that his relative was scheduled for the knee replacement surgery.
Okay.
And just about 1 week before scheduled surgery, somebody decided to check his Lyme test. Lyme test came back positive. The guy had Lyme disease. He got antibiotics, so didn't need a knee replacement anymore.
Wow.
Yeah, because that's kind of forgotten reason for not forgotten, I mean, but not that much people realize that it could be Lyme. And the problem with Lyme is that you can get it anywhere. I had a patient who got Lyme. She went for the show, and there was some animals. So she just here in Brooklyn. So she touched the animal, and that's it. It was enough.
Wow.
Yeah, and another guy, I think we talked about that. The guy was in the central of Boston, in the Central Park of Boston. Yeah, he took his shirt off and lay down on the grass. That was enough.
That was not a smart move.
No, it was not. It was not. And touching animals, even though it's in the show, is not smart either.
How do you explain arthritis? Coming back to arthritis, it's okay when sportsmen, sportswomen, I understand. Excessive weight, I understand, but I heard that some arthritis even Teenagers have, some teenagers have arthritis even. Forget about like seniors, like how it is possible.
Teenagers are not that protected. First of all, teenagers can be overweight. Second of all, teenagers are prone to trauma, fights. They might not necessarily report that. Fights, falls, and also teenagers may not necessarily be as healthy as you might think. I have a lot of teenagers, patients now, and my patients now before teenagers, they had a lot of problems when they were teens, like sore throats. Sore throat is linked to rheumatism. That's a very well-known thing. So rheumatic fever. Have you know what rheumatic fever is? That's a classic example how a teenager can get arthritis, steel disease, rheumatic fever, the same line.
Also, is it true that if you drink more just like regular water, it helps to fight arthritis?
Not to my knowledge.
Has nothing to do.
Not to my
It's a lot of mythology. Okay. So, what is your typical advice to people
Once
with
again,
arthritis?
just make it simple. First of all, we need to know the reason. And basically, if there is a big joint, it's usually wear and tear or Lyme. If it's a small joint, it's usually autoimmune. There are some exceptions, but that's what it is. So mostly weight-bearing joints are wear and tear. Okay, the big joints that are related to wear-bearing or not could be Lyme as well. So Lyme is a great imitator. You remember I told you it's a great imitator. So it can imitate anything. And small joints are usually autoimmune or somehow related to wear and tear, because sometimes the small joints can be because of wear and tear, especially because of the doing laundry.
Okay, laundry I understand, but like all doctors usually recommend physical exercise, and like people going to gym doing physical exercise, but like from what you're saying, it also can have dangerous consequences.
It depends. I usually say that if you want to live longer, do what monkey do. But have you ever seen a monkey in a gym?
Monkey no, but
No! You have never seen a monkey in a gym.
But monkey is no, like in our life when you have to sit all the time, it's better sometimes to move, even in the gym.
That's what I recommend. If you want some great activity, why don't you do chores? Why don't somebody help his wife and do the shopping,
Or her husband.
Why don't your husband, whatever it is? If he or she wants to help, why don't you do chores, Instead of going to the gym? Why should you spend your energy in the gym for nothing? And at the same time you can do something good, like gardening or laundry or cleaning apartment. Why not?
So you're not a big fan of a gym, I see.
No, not at all. Not at all, because it's not natural. Because in nature, in Mother Nature, they don't do exercise which is at the same level all the time. So somebody who is jogging, that's not what you see in nature.
But sometimes, even in nature, people can, even animals, they're like running away from trouble.
No, that's a difference.
Running away from trouble or running to get someone,
That's a different thing. So what they do, they put a maximum exercise activity for a short period of time. That's a completely different way to do that. I do not advise to do that anybody, because in our population, a lot of people, they can have heart disease, and as soon as they do strenuous exercise, it may be the last exercise they do in their life. So before doing any exercise, I strongly suggest go to cardiologist, make sure the stress is done. But what I'm trying to say is that sustained exercise with low energy expenditure is not a good way to do that.
But all Hollywood actors, many politicians, all the time I see on TV, I'm going to gym, I'm going from gym. Everybody.
Well, a lot of Hollywood actors and a lot of politicians, they do cocaine or heroin or anything like that. So it doesn't mean that we have to do it or advise them.
No, not a lot.
No, I mean, say somebody. Somebody,
That's exaggeration.
But okay, I agree that it's exaggeration, but I'm trying to make a point. Okay? It depends on how you define the word a lot. For me, a lot is more than two, you know. So
Okay, so, but how to prevent arthritis? Okay, we got how to treat arthritis. First, you have to do proper diagnostics, you
Right.
know, like, and then, like, if it's far away already, like, to do injection or to do other treatment. But, like, how to prevent arthritis? Like, one of them I got it, like, to have a proper diet. Also, some, like normal, not normal, some typical, natural exercise. But anything else?
no, I
To
wouldn't say
prevent
that. Just listen. I'm trying to make everything simple and straightforward. You know what I do? Keep it simple, stupid. Keep it simple, stupid. So basically, don't put too much weight on your joints. Don't exercise too much. You know, don't eat food that can damage your digestive system, and don't get tick bites. That's all. Let's make it
Okay.
simple.
That's a good
No
advice.
tick bites. No tick bites. As soon as you don't have tick bites, you can take a deep breath. Yeah.
What is the success rate in your office treating arthritis? Like, is it possible to get rid of it completely, or it's like just to soften the
Listen,
consequences?
whatever happened, happened. We cannot reverse, we don't have a time machine. Okay, but basically what we are trying to do reverse is probably, you know, it's an unrealistic goal. What we are trying to do is to stop the progressing disease. That's what we are trying to do. And it's quite successful. Somebody lose weight, you know, they start walking and you know, they take a deep breath. Who doesn't do that, then they are in trouble. Okay, and especially who have Lyme disease, that's a very long story, very long story.
In
It's better
general,
not to
arthritis.
get it.
In general, arthritis is a long story. It's not like 2-3 weeks and
Yeah, but Lyme
like,
is especially Lyme is, you know,
serious stuff.
yeah, it is a very serious stuff, and you know, to get rid of Lyme, not all the time, but most of the time, is progressed to arthritis. You know, you're in a serious.
How do you explain that arthritis today in America, at least, together with probably diabetes and some other diseases, are one of the most common
It's
diseases?
because
How
of the
do you explain?
overweight and improper diet and Lyme, because nobody wants to talk about Lyme. Nobody wants to admit there is a Lyme epidemic. You know, a lot of people are talking about that, but they don't wanna admit that. And the reason for that is, first of all, Department of Health plays a very big role in this, because they, in my understanding, they put too tight rules to diagnose Lyme. You know, I think that, you know, those rules should be at least revised, okay, and the labs should be more, you will use more sophisticated ways to diagnose, you know, so, because we have Lyme guidelines for quite a while, so what do you think, that nothing has changed for the last 10 years? Come on, I don't think so.
So, but if doctor recommending to take Motril, saying like, oh, it will be easier, like you have like arthritis just in the beginning, you're saying it's like it's not a good advice. Something is
No, it is.
something
It
is
is.
wrong
It
here, no?
is. It is, because if you have a joint pain, you need to go to work. If you don't go to work, you will get fired. What are you going to do? Take Motrin. And
So it's
let
not,
the
it's not
doctor-
such a stupid idea.
No, it's not. It's not.
But it's not solving the problem. It's like it's softening the pain, but it's not so. It's not arthritis is not good. Living, you know.
That's the thing. That the truth is something in between. In between. Nobody is saying that Motrin is bad. You know, it's like a person. You know, nobody is perfectly good, and there's
Yeah.
very bad. So it's always something in between. The same thing as Motrin. You know, in acute situations, it's a very, very, very good drug. Why not? But if you take it regularly, you can run into trouble. You know what? Because in Said's like
Addictive,
Motrin-
you become addictive.
No, it's not addictive, but the gastrointestinal bleed is a problem. Bleed. You know, whoever take aspirin or Motrin, or you know, especially if it's not, yes, they are prone to bleed and can bleed to death.
Yeah.
They just, you know,
So
you better think
everything
twice.
should be careful, like do it on purpose, like not all the time.
Yeah, so you'd better just get rid of excessive weight. You know, that's pretty much it. So once again, the truth is something in between. Nothing is really bad. It's not. I'm not saying it's a bad idea to take medications. No, if you take it properly, you know, it is good. Why not? I'm telling you, real situation. A lot of people, they can't go to work because of that arthritis. What I'm going to tell, not to take Motrin. Come on, this is really stupid, you know. And basically, you know what? Just to be strictly to follow the rules without detour sometimes is very bad. Let me give you an idea, a good example. You know there's Giorgiano Bruno,
Okay.
who preferred to be burned, and he didn't want to say that he was wrong. You know, in my understanding, it's very stupid, because if I were in his shoes, I would say yes, I was wrong, and just saved my life and did whatever just it's necessary to do, instead of being burned and didn't do anything after that. What's the point?
He went into history books.
Yeah, books. But besides that, what else? He didn't do anything good, you know, because he just was strict.
Stubborn.
Yeah, he was really stubborn. The another guy, the Galileo Galilei, he was much smarter.
Smarter,
Yeah, he was smart.
He said, I changed my mind.
And he lived after that, and he was doing good things, you know.
Okay, some people are just on
No,
a mission and they
to
don't
be-
want
to be
to
too
admit that they're wrong.
To be too strict is not a good idea.
Okay.
To be too strict, and sometimes, you know, heroes, sometimes the real heroes, you know what they say in Russia? Real heroes always take a detour. They don't go straight. Going straight is really stupid. The same thing is here. If I don't like Motrin, that doesn't mean that I'm not going to recommend it. Because there are some situations when Motrin is a really good advice to take. And just to make sure that we are just writing something like a bottom line. So there are no rules here. This is a war without rules. Okay, so arthritis, but basically the guidelines is here. First we need to figure out what it is coming from, and as soon as we know what it is coming from, we can take care of that. And the patient has to be really stubborn in this way, in a good way. Just make sure.
Consistent.
Consistent,
Consistent,
right.
not stubborn.
Right, you got the right word. It's really consistent with the treatment and really compliant. And who is compliant, he gets the success. Who is not, he thinks he can cheat here, he can cheat there, you know. And,
do not cut corners, I understand.
Do not, you know, that's pretty much it.
Thank you so much, doctor. Very good
My
advice.
pleasure.
I enjoyed our conversation. Thank you very much. I learned a lot.
My pleasure.
Thank you.
Take care.